Part 2. So we wanted to share with you a bit about what we've learnt about collaborative leadership in the public sector through our research, through our teaching, and through the engagement and impact work. So this section is about, are we talking more about a rave than a waltz? And I can attribute that to my colleague, Christopher Pietroni. So we've written a chapter about this, and it refers to the fact that leadership in the public sector is not something where there's a clear pattern of steps, something that's been set down before that others can follow. It's much more about making it up as you go along. And you might have heard some of the rave music as you were coming in, just to celebrate some of that. As academics, we like to come up with our own definitions of things. So Robin and I have had a go at our definitions. I won't read them out to you, but you can challenge us around these over drinks afterwards if you'd like to. I guess just to draw out a couple of things. So when we're talking about public sector, we're actually talking about a very diverse mix of institutions. So it's not just local government, it's not just the NHS, the police, it's also a myriad of voluntary sector organisations, the private sector as well, who actually deliver our public services. So it's a really complex system. And also to pick up in terms of leadership and collaboration, it's all about diversity and difference. And even though we're trying to sort of achieve a shared aim, there are many sort of different motivations and levers and reasons why we can't all just be facing in the same direction in a really obvious way. So the public sector is a real complex system, and that's why collaborative leadership is so crucial. The challenges that the public sector has to address, our societal challenges are so complex, what's known as sort of wicked issues. Any of you that work, in public management, public sector, this term of wicked issue is something that's really come to the fore. And that means that no one leader, no one organisation can actually tackle these challenges. It became this really sort of, the lexicon we were talking about, this idea of a complex adaptive system, which is something that Robin and I played a bit of sort of, terminology bingo quite often to see how many times somebody would say complex adaptive system during a webinar, and it was lots. But it's generally true. So it's really complex. We don't often know if we pull one lever here in the system, what is it going to do to the rest of the system? It's not obvious how we tackle some of these key challenges. The public sector is really siloed. So this figure shows the obesity system as sort of drawn by the Department of Health to try and work out, what are the different players in how we tackle obesity and how can we sort of pull different levers to try and change this. So, for example, if we implement a sugar tax, what will that do to the system? Well, actually, probably not very much if housing developers are still going to create, housing estates where you can only drive, for example, or if, a local authority implements parking charges for green spaces use. I don't know who might do that, but some might. So, organisations are driven by very sort of different motivations, even within the same organisation. Different funding streams, different needs to make profit, to keep their reputation, to get re-elected. So it's a very sort of complex system that we're looking at, very hierarchical and sort of multifaceted. And within our work, we've tried to sort of engage and unpick some of these real knotty issues. So our sort of funded research and evaluation, we've particularly looked at the future roles and skills that our public servants might need in terms of being able to work effectively in this space. We've looked at trying to understand how the health and care services interact and how the professionals within those systems understand each other, work with each other, and come to better working relationships. Through our executive development and our CPD, we've tried to help senior leaders understand perhaps the ways that they can be effective leaders within this system, and particularly the degree apprenticeship programs that we've been delivering over the past couple of years has really enabled us to work with a fantastic sort of senior to middle layer of local government in particular across England, and I think, you know, there's starting to become a real sort of critical mass now of leaders who understand that they have to lead in very different ways in this world. I mean, Robin's done a lot around strength-based leadership. So, you know, how can we use the strengths within the system to develop leadership approaches? We've had the National Aspiring Directors of Public Health programme, and what was fantastic about that is so we've been running this programme for maybe 5 years, and as part of that, do media training with the Directors of Public Health to help them understand their sort of leadership role within the system. And obviously, as soon as COVID hit, they became the sort of poster boys and girls for, you know, COVID. They were on the TV all the time, on Midlands Today, pinnacle of their career, obviously. So it was just really great to see the fact that, you know, the kind of things that we'd been instilling in them was then played out as they were sort of, you know, taking forward this really huge responsibility. We've also been delivering the National Graduate Development Programme for local government graduates over the past possibly 8 years, I think. I'm looking at Christopher, for a nod. Yeah, so, you know, again, really been instilling these sort of values and different ways of working into people moving into local government. The university runs the NHS Leadership Academy, which again is, you know, sort of thousands of staff joining and developing these different sort of leadership approaches. And we also did a really sort of innovative piece of work with Cornwall Council called Leading Differently, which had an apostrophe in it to demonstrate that it was innovative, which basically gave a diagonal slice of staff across the university a real wicked problem to look at. So, for example, you know, sustainable tourism, you know, second homes in Cornwall, those sorts of issues, and didn't give them any guidance whatsoever. We just let them get on with it. It was really sort of quite intense for them, but actually they learned about leading in ambiguity, having to, you know, adapt to different ways of working with partners. So that was a real innovative programme which they've repeated. And also through our engagement and impact work, so particularly the 21st century public servant work, nationally, internationally, that's also been sort of influential across Australia and New Zealand. And we've also worked a lot at a regional level. So I was on secondment to the West Midlands Combined Authority for a while, looking at developing a leadership programme for the Combined Authority. You know, Robin's actually on the Health and Wellbeing Board for Birmingham City Council, and at national level as well. So I sit on the Cabinet Office sort of advisory board for their leadership programmes. So I guess we just wanted to sort of say that, you know, we've learnt a lot, and then we try to implement it through the kind of things that we do with our students, I guess, and our partners. So what have we learnt about leadership? Just a few things that we've learnt from our particular programmes. So hero leaders, we'd all like a hero leader. We would all like somebody to tell us what to do. But actually, those people do not have, you know, the answer. And in fact, hero leadership, as we've demonstrated in our research, is ineffective and inappropriate for today's challenges. So we don't need a hero leader, but we'd all like one. And actually, we very much want a scapegoat when things do go wrong. Leadership in the public sector is really challenging. It's actually much more difficult than it is leading a single organisation in the private sector. And I think private sector chief executives probably recognise that and accept that. And people in leadership positions may well have the skills and the knowledge, but they don't always have that sort of, you know, developmental ability to realise that they're working in a sort of very ambiguous state and be able to up their sort of game in order to be able to analyse what is, you know, the right thing to do next and make good decisions. And I think what we found, particularly from our leadership programmes, is that all of the leaders we work with really want to work in a different way. They want to work across the system. They want to make a difference. But it's really hard to hold to that when you go back into your organisations because of the siloed nature of the public sector. But if you're a good leader in the public sector, you can pretty much turn your hand to anything, anywhere. And lots of graduates from all of the programmes that we've been developing have gone on to have very successful careers in the private sector and voluntary sector as well. I think I'm back to you.
Thanks, Catherine. Yeah, so alongside leadership, another big focus of our work has been collaboration. And that could be collaboration between health and social care, between acute and community care, between statutory sector and the voluntary community sector. And here's some pointers that we've got from that. The first thing is that we've been trying to get health and social care in particular to work together better for 40, 50 years. We can go right back to the 1960s to have a national directive which said local authorities should work better with hospitals. And then an evaluation 4 or 5 years later that said this isn't going very well. But even though we've tried to do that for a long time, the rationale for doing it is just as strong. And one of the projects that we're doing at University of Birmingham with John Glaspie, my colleague, and Changing Our Lives, a self-advocacy group, is looking at people with a learning disability or autism who've gone into hospital for a short period of assessment and treatment because they've got mental health difficulties or challenging behaviour, and they end up staying there for 5, 10, 15, 20 years. And you can imagine the impact that has on them in terms of their self-value, in terms of their behaviours, in terms of the mental health difficulties, and also in terms of their families being separated from them for such a long time. And one of the major reasons they struggle to come out is because of the degree of collaboration that's required. Not only do you need the hospitals to collaborate with the community health services, but also with the local authorities, with the social work teams, with the housing providers, with the care providers, with the family. And actually, it's very rare that happens. And what it should be is that usually we enable that to work, and once in a while it doesn't. Whereas actually what it is usually it doesn't work, and once in a while it does work. It's almost a surprise when somebody actually gets out and they remain in the community. So that need for collaboration is just as strong as it's ever been. The second thing is, over the last 10 years since we had Nick and David in government, we've recognised the need for collaboration. But just recognising the need for it is not enough by itself. There's a huge amount of effort that's required in order to make collaboration the reality on the ground. The third thing is we're often very naive about what's required and what can be achieved in a short timescale. So one of the projects we did at HMC was a national evaluation of a project in Wales called the Price Setters Programme. And that was about supporting innovation in primary care. It was a good programme in many ways. It gave each health board a flexible pot they could invest in their primary care teams, who either would come up with a new idea or would try and expand an existing idea. So that was all very good until it got to the end of the programme. And basically to carry on the funding, they then had to demonstrate one thing and one thing only. Did it save money? Did it reduce hospital admissions? So at the beginning, what we classically do with integrated care is we say, does it lead to better quality of life? Does it improve our workforce? Does it address inequality? But at the end of it, what we generally say is, does it save money? And the reality is, these are such complex systems, as Catherine was saying, we're very rarely allowed to save substantial amounts of money at the end of 3 years. We need to give integrated care and collaboration a longer timescale to develop. And the reason for that is firstly that the system is designed the way that we have made it, and we have made it to malfunction. And perhaps the most profound and distressing example of that, I think, was during COVID. As we know, at the beginning of COVID, there was a real concern about hospitals, and I think we can all understand that. But to protect hospitals, what they did, one of the things they did was they discharged older people into residential care homes. They didn't test properly, they didn't give the care homes protective equipment they required, and they didn't give them the support they needed. So what happened? Thousands of people died unnecessarily. Thousands of people that could have been prevented. And I don't think that was because people in the Department of Health and Social Care didn't care. It's because they fundamentally didn't understand how the system was set up to work. And when push came to shove, they went to what they knew, and what they knew was hospitals, now hospitals functioned. And it's a very profound and distressing example of why we need to collaborate better. The fifth thing is, along with the system, we need to think about the people. And when you've got someone who's trained to be a professional, whether it's a social worker, a doctor, a nurse, or whatever, they spend a lot of time and effort in getting a set of skills, a set of experiences, and they often feel quite confident and comfortable in what they do. So if we come in and we say, well, you're going to collaborate in a multidisciplinary team, and you won't make a decision, the team will make a decision, and actually somebody will take on some of your roles and you'll take on somebody else's role, they start to get uncomfortable because they were good at something and they felt confident and secure, and now we're saying to them, you need to do something different. So I think we can understand to some degree why people become anxious, and anxiety is a huge problem and how we address that. And the final thing is we just don't train people to do it. So there's still a bit where There's more reflection in the professional courses and the management courses of collaborative working, but it's still a very small bit. Often interprofessional education, where we bring professions together, is 1 or 2 days. There's a voluntary module for people who want to do it. We don't fundamentally train people yet to be collaborative. And once they're out and they're professionals, we don't use that to judge if they should still be registered. So if you're a doctor, you have to go through a registration process. Part of that is you don't ask other professions, does this person good to work with me? We don't really ask the patients, do they support me profoundly? Until we do that, we won't make collaboration a requirement of the system. It'll still be a nice to have, not a must have.
Thank you. So what have we learned about collaborative leadership? This is an example of collaborative leadership in our house. This is Connor, my rescue dog, telling me that I need to write my blog about the 21st century public servant. This is, people can see it, but this is the cartoons that illustrated all of that research. So what have we learnt? It really needs a new set of skills for our public servants to be able to work in a collaborative way across the siloed system that we've got. So we need public servants who can be resource weavers, brokers, networkers. And as Robin was saying, that's actually quite difficult for people to break out of their silos and to work together in a different way, perhaps giving up funding, giving up the comfort zone that they have of knowing their own sort of professional silo. Elected councillors have a really big role to play here. So they are almost, sort of the lay people on the ground, but then also are able to work with a range of different organisations. So elected councillors more and more have to work with GPs, they have to work with organisations like the post office around, letterbox thefts. So actually they are, again, the sort of the brokers and the glue. And I think, not all of them see themselves like that, but actually that role is something that's absolutely critical to broker some of those relationships between public servants and citizens. I guess the real enemy of collaborative leadership is siloed organisations, and we really need to change the culture in a lot of our public services to be able to challenge that and to flourish. A lot of the organisations are still, 19th century type of, bureaucracies with hierarchies, and actually you need to break that culture down and to become much more fluid, much more porous, agile type of organisation so that others can work across the piece. It is much, much harder to do leadership with others. It's really easy just to sort of, lead your own housing silo, and you know what you're doing, you know what your targets are, you know what your funding is. If you've got to then work with social workers, if you've got to work with elected members, if you've got to work with citizens to think about what this service might look like, how can we co-produce it together, that's actually really hard, and it takes a lot more effort, and it also takes a lot more time. So collaborative leadership is difficult. It also means a lot of compromise often. You can't always get your own way. It also takes longer. So, there are many reasons why people don't want to do collaborative leadership, because actually it's much simpler just to carry on as we were. And I think it perhaps sometimes requires leaders to recognise their own limitations and realise that actually they don't know some of the answers to these questions, and there are probably others out there who have a better idea of what the answers might be, or at least what the questions are that we should be asking. So it's about perhaps a bit of humility and recognising that perhaps there is some developmental work that needs to be done to carry on learning, perhaps putting yourself in a difficult situation in order to experience a bit of sort of cognitive development. And the final thing I want to say, so this is a quote from someone who was a chief executive of both a council and a PCT at the time, Primary Care Trust. And what she said was, actually you can achieve anything if you don't feel the need to take the credit. And I think that's really interesting, because the way that we reward people, the way that we reward organisations, is those who have done it. So if you've done it, great, take the credit. And actually it is really difficult to have a reward system that rewards everybody for the effort that you put in, even though maybe we didn't achieve it.